On the surface, Dunedin woman Kylie Williams appears normal and healthy, but internally her body is prone to attacking itself.
So it's maple syrup urine disease. It is fairly rare within New Zealand. There's a small number of us, so the incidence is 1 in 150,000. So that's actually across the board, Australia and New Zealand.
The genetic condition is passed down when genes from both parents combine to create a defective chromosome. Williams says she was diagnosed early, getting the condition under control. However, her early life featured many trips to the emergency department.
As a child, I think my parents probably lost count of how many times I was in and out of hospital with, like, something as simple as an ear infection could trigger the MSUD. So yeah, I was in and out frequently, many times. I was told she's not going to make it.
World Rare Diseases Day was recognised recently, prompting Williams to speak up about her condition. A rare disease is classified as affecting 1 in 2,000 people, making Williams's 1 in 150,000 condition very rare. Researcher at the Dunedin School of Medicine, Dr. Cherie Stainer, says it's easier to get funding for the study of common ailments than it is to look into rare diseases.
It's harder to get funding because you're competing with diseases that are much more prevalent in the population. There are some organisations like Cure Kids who do support research into rare diseases, because a lot of rare diseases actually affect children. Probably 72% of them are genetic.
Stainer says there are about 6,000 rare diseases and says the organisation Rare Disorders New Zealand is lobbying for nationwide infrastructure to be put in place to help those affected by a rare disease.
There's a real need to develop a national framework, and I know Rare Disorders New Zealand is really working on that. So they've got 7 proposals that they're trying to put in place, including a sort of a clear clinical pathway for patients so that they can have their needs met, get a diagnosis, and be able to access the services that they need.
She says although people like Kylie Williams, who suffers from a 1 in 150,000 person disease, are rare, there are many people who have a rare disease, making it quite common to suffer from a rare disease.
Maybe 300,000 New Zealanders are affected by a rare disease. And so it's hard to get funding for research because they're obviously looking at, each disease in isolation, but as a group they affect a lot of New Zealanders, and I think it's really important for this sort of framework to be established in New Zealand so that rare diseases are recorded. So at the moment they're not even recorded in a registry, so that would be the first step to be able to identify which rare diseases are affecting New Zealanders.
And despite her condition being incredibly rare, Williams says there are international networks in place where sufferers can seek support.
It's big. I don't know exact numbers, but I mean that support group is worldwide, so they're covering like the whole of the States. They've got Aussie, New Zealand.
She says she's lucky to have the intermittent version of the disorder, which flares up at times, where the classic type of maple syrup urine disorder can be fatal. Clinicians say the prognosis is good for those who are diagnosed early, treated promptly, and who follow a strict lifelong diet. In Dunedin, the South Today.